Thank you so much, Ilse, for the introduction. It's very exciting to be here. This looks like a tremendously enthusiastic group, and I wish I could be here for the whole Social Finance Forum. It sounds like you're talking about some very exciting ideas, and I could feel the energy the minute that I walked into the room. So congratulations to all of you. Would love to hear about all of the projects that you're working on, and I can just imagine that every brain in this room is churning with ideas as you continue to hear from one another. It's such a pleasure to be here at Mars, and this is a place that I have visited on multiple occasions and have good memories of other events that I've been here for and other important announcements. But it's my first time since being appointed Minister of Health that I have the opportunity to be here. So I don't know why it's taken me a whole year to get here, but really glad to be here. I wanted to acknowledge Member of Parliament Julie de Bruzen, who's one of my colleagues in the House of Commons, represents the riding of Toronto Danforth, one of our great Toronto MPs. So great to have her here and great to see so many other colleagues in the room. It has been a really amazing year. A few interesting challenges in health this year and many more yet to come. But I'm truly honored with the trust that the Prime Minister and Canadians have placed in me to take on this task. It's not something that anybody could do alone, and it's wonderful today to think about many of the partners who are here in the room that make the work of my mandate possible. We work, of course, with the provinces and territories and working on some really interesting things there now. As you may know, the idea of innovation is actually part of the discussions that I'm having with my counterparts in the provinces and territories as we work our way towards a new health accord, and even the other features of the health accord, things like home care and mental health and pharmaceuticals and Indigenous health, are areas where there's so much opportunity for innovation. And as I hear you talk about the ideas that are being discussed here, I think about so many other applications and look forward to further conversations about that. The mandate letter that the Prime Minister gave me, of course, talked about some of those specific things that I was to do in terms of negotiating a health accord, for instance. But if you look at it, it actually talks about a larger social goal. And I think that's what today's session is really about, is our large social goals for public health and population health. And that involves, of course, making sure that we enable and support, empower Canadians to make the choices that they want to make and are absolutely able to make and enthusiastic to make, so that they can be active participants in improving their health, both their physical health and their mental health. So that's why it's wonderful to be here at the forum today, to be with innovators who have spent so much time literally rolling up their sleeves, working with others, driving social change, and to be here in Mars, where it has such a deep culture of innovation, is absolutely perfect. So as Ilse mentioned, I am a medical doctor. I actually spent some of the very early years of my career right in this neighborhood. I spent a year with Jay Keystone at Toronto General Hospital, and then a year teaching in the family medicine teaching unit at Toronto General before I headed off to West Africa. So it's kind of fun to be back to my roots. And then as part of the early stage of my midlife crisis, I went back to school and while I was doing family medicine, and did a master's in public health. And that midlife crisis kind of led me on to run for office. So, midlife crises are not all bad. But public health has always been something that's important to me, and I absolutely loved the opportunity to study the issues related to that here at the University. I say here at the University of Toronto because I know you're so intimately connected to the academic partners in this area. But the vantage point of looking at these issues from both the medical perspective and the public health perspective has helped me to kind of see the health system writ large, and what we do well for citizens and how we don't support them well. And of course, there are many things that the Canadian healthcare system does with superb effectiveness. Things like treating broken bones, doing organ replacements, all sorts of wonderful, fantastic tertiary healthcare delivery systems that take place right here in this very neighborhood. We also, of course, when it comes to public health, do a very good job at intervening, for instance, in disease outbreaks as they occur, and we effectively have I think, an excellent track record in containing illness and protecting protecting populations. I also think that one of the things Canada does superbly is in the area of health research and finding ways to have a whole range of high-quality health research promising for helping to promise a better tomorrow. And in no way do I want to overlook all of those tremendous strengths, but I think, and this came up in our conversations already this morning, that we don't do ourselves any favors by not acknowledging that there's so much room for improvement. There's so many areas where we actually aren't as efficient as we ought to be. There's so many areas where we have not served Canadians well in our healthcare system. And I just wanted to touch on a few of those today, because that's what this event is about how can we actually do better. And I think that one of the things is that the work of healthcare providers who are on the ground, at the coalface, day to day, one-on-one with patients, it can't be disconnected from the big picture, from the public health and from the population health perspective. And I think increasingly my sense was among physician colleagues that increasingly physicians are realizing and wanting to be involved in that space, and I suspect other providers are as well, to realize that we aren't going to be able to solve the big health issues in our that our country faces on a case-by-case basis, and in fact that we need to look at what are the solutions on a population scale. Secondly, and you've probably heard me say this before if you've ever heard me speak before, because I try to mention it all the time, is that improving people's health is about so much more than health services. And in fact, that's part of why I went into politics, because I learned very quickly, as most people in the health sector do, that it takes more than medicine to make people healthy. And so I talk about this all the time. You can imagine that we actually talk about this around the cabinet table in Ottawa. I like to say that every minister, to a certain extent, is a health minister, and every policy that we make at that cabinet table and in the House of Commons is all about actually health policy, because ultimately almost every decision has an impact on people's health. So I'm proud of the work of my department and of the Public Health Agency of Canada, for instance, on the amazing health initiatives that are undertaken, but I want to emphasize as well, as you're thinking about social finance, that actually what makes people healthy, as I'm sure I don't need to tell you, is many of the other decisions that are made at the level of government. So, for instance, we're very proud of some of the decisions that have made from an economic perspective in government. I think probably the one that will have the biggest impact over time is the Canada Child Benefit that we introduced this year, estimated to lift 300,000 Canadians, children out of poverty, just by being able to make sure that the families who need investment in their children and who need the ability to give their children the opportunities for success and for health will now get that kind of support that they need. So investing in the whole range of social determinants of health is part of what it's going to take for us to keep people healthy. And then I think the third area that I wanted to emphasize, where I think we need to do better, is to drive our health innovation and our system change from the perspective of the patient, from the perspective of the citizen and of the individual, and to think about what it means for that individual to move through life and to move through healthcare systems. And we need to make sure that our health services and our public health structures really look at how we can make things better from that patient perspective. It has to be a guiding principle of what we do. We need to work in partnership with Canadians, think about what their day-to-day lives are like and how we can actually support them. So that brings us to today's announcement, which is related to this fantastic community hypertension initiative. You know, there are a whole range of reasons why hypertension and cardiovascular disease are growing problems in Canadian society, but perhaps one of the most obvious ones is the fact that half of Canadian adults report being inactive. And we know that physical decline that takes place between the age of 30 and 70, and I suspect the majority of us, and I know most of you in the room are younger than I, but most of you are still in that 30 to 70 bracket. And our physical decline that's taking place in our bodies is in large part a result of our inactive lifestyle. And there are things we love about our inactive lifestyle, because we all love to sit back and enjoy all of the the good things that you can do while you're sitting on your bottom. But we don't do ourselves a favor by allowing ourselves to indulge all the time, and we need to find ways to encourage one another to an active lifestyle. So one response to the challenge is to keep doing what we're doing and to keep dealing with things at the end of the line, and that happens around here every day. There's fantastic innovation being done in terms of things like better surgical techniques for cardiovascular disease. There's all sorts of new invasive technologies, better drug-eluting stents, speedier development of pharmaceutical solutions, including statins and all kinds of other drugs. But with, of course, due respect for all of the people who are working very hard in those important areas that literally save lives, we have to do even more at the front end. If we're going to reverse the trends so that people are going to live longer, healthier, active, meaningful lives, it's going to be, it's more than just a lofty goal. The evidence shows that finding ways to encourage people to be more physically active, to eat, to make better eating choices will, as you all know, actually help to reduce the risk of chronic diseases and premature death from cardiovascular diseases, as well as so many other health conditions. So that is exactly why, through the Public Health Agency of Canada, I'm very proud of the fact that our government is investing $4 million in the Heart and Stroke Foundation of Canada to implement the Community Hypertension Prevention Initiative over the next 3.5 years. So let's hear it for always nice to believe that to be making investments and to know that we're doing the right thing. Through this initiative, we as a collective are testing how a social impact bond can work to achieve better public health outcomes and health objectives for the population. So a group of fantastic investors are providing the upfront capital to run the project, and the government pays, as was already said earlier, when and only when those predetermined outcomes are achieved. So literally the federal investment is paying for success. So with the Community Hypertension Prevention Initiative, we are helping, and you'll hear more about the program, but it's essentially focused on pre-hypertensive adults over the age of 60, at this point in Ontario and British Columbia, to lower blood pressure and therefore improve their likelihood of living a healthy life. So we're doing this by giving them access to health coaches, which everybody would love to have, online tracking tools, community resources like walking clubs, nutrition classes, cooking classes, encouraging people to make good choices and understand how they can do better. This is the first time that this type of financing model has been used by the federal government in the health and public health policy area. So you are here, it's a big day for us. It's this kind of partnership among the public, private, and not-for-profit sectors that brings together the expertise, the resources, and the reach that's actually necessary to address these complex issues in our society. And if the evaluation shows that the model is effective, and we have every confidence that all the partners will work together to give it every opportunity to succeed, we're going to be able to assess this model and actually to see how it might be used by government and others again in the future. So I truly want to thank the Mars Centre. I want to thank the private and not-for-profit sectors, the private investors, for their incredibly valuable financial support for the project, without which something like this isn't possible. So in particular, I want to acknowledge Shoppers Drug Mart, RBC Generator, TELUS Ventures, McConnell Foundation, QBE, Catherine Donnelly Foundation, Mindset Social Innovation Foundation, Max Bell Foundation, and Bill Young. So let's give it up for all those fantastic investors. I hope some of them or their representatives are here today and feeling very proud of what they're doing. Canada is a world leader in health promotion. We know that we have to keep up with the times, though. We have to leverage not just technology, but we have to leverage insights into human behavior to help make sure that the progress is sustainable. So through the Public Health Agency of Canada, we are investing about $20 million every year in partnerships similar to this, but not quite as specific as this. And we're working on the ground in communities across the country to create conditions for good health. Those federal investments are leveraging new investments from private and not-for-profit organizations, and our $20 million investments in that area has leveraged $43 million to give outcomes that will provide better community leadership and more commitment to public health. So I wanted to just mention two others that we're working on, just so that you know that there's a lot happening in this area. You may know that Canadians are some of the world's largest consumers of loyalty points. And in fact, apparently 90% of Canadians belong to at least one loyalty point program: Aeroplan, Petro-Canada, Scotiabank, Scene movie program with Cineplex. I bet you could all pull out your wallets and show me all your loyalty cards. The average household apparently collects points from 8 different loyalty programs. Now, the problem is you can never have your card with you when you want it, but that's another social innovation we need to work on. Let's face it, loyalty programs work, and traditionally they've been used to influence our purchases, to collect data about how we shop, but we can use these things for other purposes as well and to drive healthier choices. So that's actually behind a couple of interesting projects that we've been partnering on. One is with the YMCA, and it's testing how incentives and loyalty programs can actually encourage Canadians to get healthier. So through this particular partnership, YMCA members have a loyalty points program, and as they reach specific milestones, they get rewards along the way. And the data is showing that almost 2/3 of YMCA members that are accessing this program in test sites are going to the Y up to 3 times more often each week when they're offered an incentive with loyalty points. So think about that as you're tossing ideas around in your head. With incentives like that, we're learning how to continue to use these kinds of programs for public health. Another program some of you may have heard of is the Carrot Rewards app. And we're helping Canadians to be more physically active and eat healthier by giving them, in this case, a choice of loyalty programs for a variety of other providers if they do things that are healthy. So this is an app that was developed by Carrot Insights. It's a partnership between Public Health Agency of Canada, British Columbia Ministry of Health, Heart and Stroke Foundation, the Canadian Diabetes Association, the YMCA, and the BC Healthy Living Alliance, and a private sector partner, Carrot Insights. So Canadians in British Columbia, and actually now also in Newfoundland and Labrador, are using this app. They get to access their choice of what loyalty points they would like to get, and it's another way to encourage people to be active, get points, and nudge themselves towards healthy living. And we're hoping to expand that program further. I think it has a tremendous amount of potential. In this room, I know for sure that there's no shortage of great ideas. I firmly believe that the health sector is an area where we have lagged behind on innovation, and I'm determined to work with partners like all of you to make sure that we do better. Health innovation is a great area of opportunity, tremendous social and economic results, positive results that Canadians can access through innovation. And these innovations, like the announcement that you're hearing about today, truly are just the tip of the iceberg when it comes to our collective efforts. So I know that my officials and I are going to learn a lot from the experts in the room. It's my hope that we are going to be able to connect increasingly, to collaborate, to find innovative policy solutions to address the very profound health challenges that we face as a nation. So I wish you a very rewarding forum. I look forward to hearing more about what you're doing, and thank you for the pleasure of inviting me here to be with you today. Merci beaucoup.